This technique is a prone technique with a patient lying prone that's done to restore mobility at the superior Tib Fib joint. So again, I have a skeleton model next to the leg here, and I'll show you in the skeleton how I like to do this technique. So again, it's a percussive technique. I'm going to have my thumb on the back of the proximal fibula, provide an anterior glide. That becomes my check position too, where I make sure I ask the patient that that's tolerable. I want to consider that the fibular nerve runs in that area, so I want to make sure they're not getting a kind of a tingling or a nervy sensation down their leg. Give a little bit of an anterior glide. Then I'll do a little practice percussion. Ask the patient if it's okay if I hit my own hand in that position, and then if so, go ahead and give it a whack, so to speak, to percuss the fibula anterior on the tibia. A couple things to consider again on the skeleton is what you don't want to do is hit the fibula directly into the tibia. So if you kind of go anterior lateral a little bit with your direction, you decrease the risk of kind of hitting the fibula into the tibia. So think about that from a direction standpoint, that my glide is going to be anterior lateral and not straight anterior, so I can avoid hitting the fibula right into the tibia. So it looks like something like this. My thumb's on the back of her fibula there. I can give it a little bit of an anterior glide. Make sure that feels okay to my patient, that there's no neurological symptoms come down from that fibular nerve. And then I'm gonna get this out of the way for a second. Ask the patient if there's permission, if I can hit my own hand. Get permission, give the glide, that's the end range, and then give it a whack. Again, I'll show you. Give it a whack. So the percussion is anterior and a little bit of lateral to restore motion at that superior Tib Fib joint. You can then check mobility in this position to make sure it's restored, that you have an anterior posterior wiggle. Again, lots of times this patient that needs this, one of their asterisk signs is that resisted or active knee flexion hurts. So I could have the person reassess, lift your foot off the bolster, hold in that position, and make sure that that no longer hurts when they actively use their hamstrings or have resisted hamstrings on that posterior aspect of the fibula.